Good morning, and welcome to this week's episode of Ask Dr. Murphy. I hope everyone is doing well today. My name is Katie Berg. I'm a research study coordinator with the Havey Institute, and I'll be leading today's discussion. I'd like to welcome and introduce Dr. Robert Murphy. Dr. Murphy, how are you this morning?
Doing quite well, thank you.
Dr. Robert Murphy is the executive director of the Havey Institute for Global Health and the John Philip Fair Professor, of Infectious Diseases here at Northwestern's Feinberg School of Medicine. He answers your COVID, infectious disease, or public health questions each week on the Havey Institute for Global Health's Facebook page. If you have any questions or suggested topics you'd like to see, please submit them down below via Facebook at NU Institute for Global Health or by email at globalhealthinstitute@northwestern.edu. Today, Dr. Murphy will be answering a viewer-submitted question and addressing our latest headlines and lone COVID statistic through today, August 2nd. Starting with that COVID statistic, average COVID deaths per day, 51. Last year, the same week, we saw 87. Dr. Murphy, your reaction to that number and general COVID reporting?
Yeah, so last week we reported that the number had jumped up to 37, and we thought maybe that's a fluke. We didn't know, but it's not a fluke. It's real, I think. You know, you've got two weekly reports going up. This should be really no surprise because everyone knows we're having this new wave now, and that started about a month ago. And about a month after an infectious wave starts, you start unfortunately finding that some of the most vulnerable people have passed away from the disease. So this is unfortunately very real and actually makes sense. So, 51 per day, that's 18,615 per year. So this is very serious disease. People are writing it off and thinking it's not important anymore, but this is a lot of morbidity. This is a lot of medical problems. It's a public health problem. Also, if you look at the wastewater viral activity, it's high or very high in most of the United States. So over half the people in the US are in areas where it's high. So if you get sick, if you have any kind of upper respiratory tract symptoms, get tested, find out if you have it. And if you're one of the people that's eligible to take Paxlovid, it is available.
Mm-hmm. And yeah, on the topic of public health, we received a great question from a viewer this week who visited a small farm in Indiana over the weekend, a place where they offer farm tours, kids are able to interact with the animals, pet the chickens, milk a cow. And they're wondering how safe that was given the state of the bird flu around the country. Is there any guidance change that's occurred?
Well, this is a really good question because we've had so much problem with avian flu in poultry and cattle in particular. Fortunately for this person, there have been no H5N1, that's the avian flu influenza, affected dairy herds in the state of Indiana. Michigan has reported cases. Colorado has been reporting cases. But Indiana so far has not done it. Not reported any cases. So I think in this particular case, this particular instance, that there's really no risk. Now, that doesn't mean there won't be risk in the future. So some things that you should just in general keep in mind, don't have any direct or even or sustained contact with any animal that appears sick because they could have avian flu. That's just makes sense. And then after you've been in contact with some of these animals, good washing of the hands or use of some alcohol hand sanitizer is a good idea. Try to avoid touching a contaminated hand to your face in particular. And just keep in mind the risk to the public still is very low. And the only people that have actually become infected with avian flu, the 13 people in the United States that are now reported to have it, are dairy workers. There has been no cases in people who've just visited, a dairy farm like this person is talking about. So that's a lot of contact, a dairy worker. That's every day you're in there doing it. So it shows you that it's actually difficult to transmit at this stage. The fear is if a person gets exposed, a dairy worker, for example, gets exposed to avian flu and gets the regular flu at the same time. It's possible those viruses could mix. And that's why there's so much just general concern. And so keeping the risk low for general flu is very high. Now, remember, the regular flu is very seasonal. It starts picking up in November, December, and goes until approximately March. It's a typical seasonal disease. So right now there's not a lot of flu, but this season, we've got to really be careful, especially with these farm workers.
And on the topic of those farm workers, there have been mostly dairy workers, a couple of poultry workers who have come down with H5N1 in these recent outbreaks. Can you tell us a little bit more if there's been any more response from, our government agencies to help out with this?
Well, they're trying to vaccinate regular farm workers, with the regular flu vaccine to make sure they're up to date on that. As I mentioned, you don't want to have both of these at the same time. That's when they can possibly mix and cause a virus that that's more deadly that can affect the human population. So this relatively small grant, $10 million, is for those people at high risk, and anyone working around poultry, flocks, or cattle are going to be offered these vaccines for the regular flu. And that's basically what's going to happen, because there's estimated over 200,000 dairy workers. And so this is all voluntary and is going to be starting very soon.
Now, flipping back to COVID for just a moment here, there was a very large study out of England recently regarding COVID vaccination and cardiovascular events. Can you tell us about what the reporters found?
Right. So in many other countries, many other high-income countries, and even some lower and middle-income countries, the medical records of the patients are very centralized. So they have these massive databases of people. They know when they come to the hospital, they know when they pick up medicine, they know when they go to the doctor, they know what diseases they have, and they can take that data and analyze it in certain ways. We have a similar database like for veterans. The veterans database is enormous, and we can do the same thing with that, but not for the general population. But anyway, so in England, they studied 45.7 million adults from 2020 to 2022, and they found that the incidence of heart attacks, strokes, and pulmonary embolism and deep venous thrombosis in the legs was lower if they had COVID vaccinations. And the association was strongest with multiple vaccinations. In other words, if you had the first two plus one booster or two boosters, the more vaccine boosters you had, the lower this event rate. The only way you can say that this is protective is you have to have a massive database like this, 45 million people. And I think it's, does that, is everybody at risk for heart disease and stroke? No, but it is still, one of the biggest, killers of people. It causes the most deaths in the country. And so it's very important. So particularly people who are at risk for heart disease, if they have a family history of heart disease, they have diabetes or hypertension or any of the classic cardiovascular risks, they really should seriously consider keeping up to date with the COVID vaccine, because that will prevent them from having serious COVID if they get it. And COVID is associated with these kind of events. So this is it. I think it's very important data, and it's powerful because the study is so big.
Mhm. And the researchers also confirmed the extreme rarity of some of the cardiovascular events seen from vaccination, and
Mhm.
that again showed that the risk of not getting vaccinated came along with a lot more problems than getting vaccinated in this case.
Right. Good point.
Now, switching gears to measles cases in the United States. Here in Chicago, we previously had a large outbreak that thankfully has been quelled. However, there still have been cases popping up across the US. Can you let us know how we're doing on measles in the US this year?
So why are we worried about measles? We're worried about measles because measles actually can kill you. It can cause encephalitis, and it particularly is serious in young children. And what we see now this year is that the cases are up threefold, triple the amount of last year. And we're only in July. So, it's going to increase even more. So of the 188 cases, um, uh, uh, there were only 58 in all of 2023. But in these 188, 93 resulted in hospitalization, mostly in kids under 5. So, a kid to get that sick has to go into the hospital with a contagious disease. I mean, it's really, really very, very unfortunate. Now, the outbreak we had here in Chicago with the 50 cases, mostly from migrant community in the Pilsen neighborhood, the CDC came in, helped the city and state health departments, and they gave out thousands of doses of the MMR, the measles vaccine, and the little mini epidemic here went away. So, this is all preventable. So most of these cases are in unvaccinated people. So the in 2022 and 23 school year, 93% of US kindergartens were fully vaccinated. Measles is so contagious that the data exists that if you don't have 95% coverage with vaccine-induced antibodies and immunity in a population, you're going to have outbreaks. So already we're 2 points down. And that's why we're having so many problems. Keep in mind, when the vaccination rates were above 95% in the year 2000, there were no measles cases. It was eradicated. But those numbers are coming down. 12 states and Washington, D.C. together reported vaccination rates less than 90%. That means this is just going to become a standard disease now. Measles is just going to keep showing up. Kids are going to end up in the hospital. Unfortunately, some of them are going to die because this vaccination rate is so low. So it's really unfortunate.
Incredibly unfortunate. And looking to another disease that we hope does not continue to gain traction, the WHO pre-qualified a new vaccine against a specific strain of poliovirus. Can you tell us what pre-qualified means in this context, about the vaccine itself, and why it's needed?
Yeah. So what's happened is because of political disruptions around the world, and the distribution of vaccines and polio, I mean, the Gates Foundation and others and WHO have tried to eradicate polio. So there's two kinds of polio. There's the wild type kind, that's the regular wild virus, and there's a milder type that comes from polio virus is an attenuated live virus that you shed. The body sheds it, and that actually the person is protected from polio, but they shed the virus, and people that are unvaccinated can get that vaccine produce virus, the vaccine virus, and get polio. So they made a vaccine just for that type of polio, because that is actually the most common type. Once everybody gets vaccinated and everything, all this will just die down. But this is just WHO pre-qualified. That means that they're going to be able to sell it and give it away to all sorts of people to lower the polio rate and try to get this thing under control. We were almost eradicated polio. I mean, it was so close. And we just keep having these stumbles. So Biological E is the company and the vaccine, and in collaboration with an Indonesian company called PT Biopharma, are manufacturing it, and they can produce up to 500 million doses. So this is just a great thing towards further reducing polio in the world.
Mm-hmm. Now, another infectious disease we have talked a lot about this year, not so much in the past few weeks, but is still going rampant, Mpox. There was recently an announcement from the Africa Centers for Disease Control and Prevention regarding Mpox. Can you tell us about what they announced?
Yeah, so there's two types of Mpox, clade 1 and clade 2. So clade 1 is the one most common in Africa. And clade 2 is the one that's kind of circulating globally, particularly in men who have sex with other men. It's become a sexually transmitted disease there. 10 African countries now report Mpox. So this is a big jump up, including Rwanda and Burundi for the first time ever reporting having an Mpox cases. Most of these cases are in children under 15 that are in contact with infected rodents. They've also can result in death. The death rate depends on the population you're looking at. Been reported as high as 10%. This is for the clade 1. But if you look at all the numbers together, the aggregate numbers, it's about 3%. Still, this is terrible. With the clade 2, the one that's circulating worldwide, the death rate is less than 1%. It appears not to be as severe, or for some reason those people are getting treated or whatever. So now remember, there is a vaccine that's available for Mpox. And the uptake in the United States anyway, and many of the other high-income countries, is actually very low, 25-30% or so. And in Africa, it's extremely low. And unfortunately, not a single donor dollar has been invested in containing Mpox globally. It's just all talk and nothing happens. So it's unfortunate. And this can flip out of control again. Look what happened with the clade 2. What if there's a clade 3 or 4? So anyway, it's important that this gets under control. WHO is trying to deal with it in the Africa CDC, but they have many priorities, and they don't have all the resources to do this. So it really needs to move up the list of things that are important that need to be addressed globally.
Mm-hmm. Now, sticking with that topic of priorities, last week we touched on the global fight against the AIDS pandemic. This week, there was an announcement on some domestic funding here in the US and some global vaccine news. Can you fill us in?
Yeah, so what is happening is $68 million in funding is going towards enhancing maternal health initiative program to continue to decrease HIV infection by 90% before 2030. And so the group they're targeting are 560,000 low-income people with HIV. And 142,000 women receive assistance, and 90% of those women who reach viral suppression with this assistance, they don't infect anybody else They don't transmit it to the baby. They don't to their sexual partners or anything. So it's good. It's going where the problem is, and this is a very necessary resource to get this infection under control. It's totally doable. It just takes the resources and the will.
Mhm. And what about those vaccine candidates? How did they turn out?
Oh, with HIV, developing a vaccine for HIV has really been challenging. When I first started my career, I remember one of the big leaders in my medical school said, why are you going into HIV research? There's going to be a vaccine in a couple of years and the whole thing will be gone. Wrong. Okay. So just one vaccine after another failed. And unfortunately, these two vaccines that were being studied, both were ended up in futility and failure, and the studies just had to stop because the vaccines didn't work. So it's back to square one.
Mm-hmm. Back to square one on the vaccine front, and hopefully getting a generic version of that subcutaneous PrEP developed
That
somehow, some way.
prophylaxis drug, there was a huge advance. We talked about it last week. So 2 injections a year, every 6 months, you take an injection, prevents infection. So we may never have a vaccine, or the vaccine may be very far off in the future. But until then, there's other things we can do. We can help these women who are infected, have them stop infecting children and sex partners. We can do this pre-exposure prophylaxis in any high-risk group. And that's what we can do. And we can do it successfully if we've got the resources and we can implement the projects in the correct population.
Mm-hmm. Well, on that note, thank you very much, Dr. Murphy, for your time, your expertise, answering our viewer submitted question, breaking down the latest headlines and research for us. It's much appreciated.
Well, thank you, Katie.
And thank you all for joining us for another episode of the Ask Dr. Murphy series. We hope to see you back next week. And as always, if you have any questions or topics you'd like to see discussed, please comment them down below or at any of our social media linked in the description. Have a nice day and a nice weekend.